so much to each and everyone for joining. It's going to be a very quick 10-minute session as far as Mirena is concerned. No wasting time, just to give you a basic sense and a basic understanding as to what exactly are we trying to do when we try to look at Mirena and think about Mirena. Okay, so 2 or 3 things. For people who get confused, what is Mirena? Please remember, Mirena is basically a hormonal device which is put inside your uterus, right? Where exactly in the uterus it is put? So if you look at this is the cavity of the uterus here, center of the cavity of the uterus. It is going to go in the center of the uterus. How is a doctor going to put Mirena? They will put it through the vagina. Okay, so they will pass a small device. There is an applicator. They'll push the Mirena inside and it will go and stay in the cavity. Now it is important that a patient understands, if you have disease in the pelvis, that means if I look at this uterus and if I look at these ovaries, and let's assume you have one side 5 centimeter endometriotic cyst, another side you have 4 centimeter endometriotic cyst. Let's say in the uterus you have adenomyosis, you have fibroid, something like that. And then if you put Mirena, then Mirena is useless. Mirena is brilliant if you have cleared the endometriosis from inside. That means ovarian endometriosis removed, rectal endometriosis from behind removed, another ovary endometriosis removed, uterus adenomyosis you have treated, and after that you have put Mirena in the uterus to make sure that Mirena is a locally acting hormone support so that it does not cause any increased risk of recurrence in your body of developing endometriosis and adenomyosis after complete surgery. You cannot be doing an incomplete surgery. That means you cannot be saying that, okay, I removed endometriosis from the ovaries, but rectum pe operate karne ko mere ko nahi aata because I am not a specialist. So let me do one thing. Let me just remove the ovarian endometriosis and let me put Mirena. You cannot put Mirena saying, Acha, patient is having pain, but I don't know how to operate, but I don't want to let this patient go to a super specialist also. ठीक है, मैं patient को पकड़ के रखना चाहता हूँ. In that situation, put a Mirena inside. Wrong. Mirena will work best as per the guidelines. One of the best devices in post-surgical suppression, provided the surgery has been performed, attempted, and done completely. It is the best use case scenario for young girls or for girls who are not immediately planning to get married, let's say for the next 2 to 3 to 4 years. Excellent suppression, beautiful as far as local body control is concerned, with 2 or 3 problems. One problem is some women have irregular spotting due to Mirena. That means once you put the Mirena, some women get irregular spotting. They don't know when, but they will get spotting. So that is one problem. Second, some women report some amount of water retention in the body. So some amount of weight gain is reported by some of these young girls. Apart from these 2 normal problems, of course, there is a list of criteria where you can put Mirena and where you cannot. That is not a part of this lecture because patients should not understand that. That is a part of medical these things. So only some women report some amount of water retention. So only doctors should probably look into that, right? But apart from this, if you are a patient who is having any of these problems, then remember one thing very clearly. Mirena only good in your situation in endometriosis if you are trying to look at post-surgical suppression. Do not do not try to think that Mirena is your magic device, and if you put Mirena, you will avoid a surgery. The main thing which all of you should understand is quite a lot of times you are made to feel that instead of surgery, put Mirena. That is absolutely wrong. Mirena is great. And as far as guidelines is concerned, you need to put it only after the complete surgery is done, right? One more question. One more thing which people often ask us, right? How long can the Mirena be kept inside? So remember, the official life of Mirena is 5 years, right? But in young women, it can extend for up to a year more. So maybe 6.5 years, you can safely continue to use Mirena. It is a very tiny dose of progesterone which it releases in the local environment. So it goes and acts in the uterus and in the surrounding parts of the pelvis, and some amount of absorption can occur in the bloodstream. But it is very, very microscopic dose. Okay. We normally like to make sure that women who have put Mirena also have a once in a year follow up, okay, with us. And this once in a year follow up is going to be extremely, extremely important to make sure if the Mirena has not got displaced, that means if the position has not got changed, right? With this is the only thing you need to know as far as Mirena is concerned. Nothing beyond this. If you are a patient, I shall be happy to answer your questions on Instagram when we hold our question answer sessions. I normally don't log into Instagram. I get an opportunity to come to Instagram maybe once in 2 months. So if in case I'm having logging in onto Instagram, we shall be happy to answer your questions. This lecture should be available on YouTube for all of you to see. All the best, and God bless you. And as promised, our language will continue. Our language of instruction would continue to be in English. Okay.